Welcome to the second segment of our Health Equity Basics Learning Series. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. This segment covers some common terms and definitions associated with health equity. Health equity is the equal opportunity for all people to achieve their highest level of health, regardless of race, ethnicity, sexuality, socioeconomic status, or other factors. Sometimes health disparity and health inequity are used interchangeably, but there is a subtle difference between the two. Health disparities are differences in health status among distinct groups of the population. Based on information from the Centers for Disease Control and Prevention, women in the U.S. tend to live longer than men. This is an example of a health disparity. These disparities can be caused by different factors. Health inequity comes from health disparities that are a result of systemic, avoidable, and unjust social and economic policies and practices. Health inequities are responsible for many of the health disparities that affect historically marginalized people or disadvantaged communities. Healthcare disparities are differences in access to or availability of medical facilities and services. Health disparities can also be variations in rates of disease occurrence and disabilities among socioeconomically or geographically distinct population groups. Equality means each individual or group is given the same resources or opportunities. Everyone is treated the same. Equity recognizes people come from different circumstances and backgrounds, so to achieve equal outcomes, each person may need different or unique resources or services. This image helps illustrate the difference between equality and equity. Equality provides the same resources and services to everyone. What is provided to address an issue may be equal or the same, but the results or outcomes will likely not be. Equity, on the other hand, seeks to customize the level or types of resources provided based on a person's individual needs. Equitable strategies lead to common outcomes by ensuring sufficiently similar opportunities for individuals and communities so they can achieve their full health potential. Diversity is any dimension that can be used to differentiate groups and people from one another, including but not limited to national origin, language, race, color, disability, ethnicity, sexuality, age, or religion. Equity means everyone is treated according to their diverse needs to achieve the same positive outcome. Inclusion is a state of being valued, respected, and supported. It means considering every individual's needs and recognizing their uniqueness. When we treat people equitably, we are being inclusive, allowing everyone to participate. Health equity helps each person attain their highest level of health, while culturally and linguistically appropriate services focus on appreciating each person's uniqueness. Class can increase health equity by promoting respect and acceptance. The concepts of class work together and reinforce each other. Social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. The term health-related social needs is sometimes used interchangeably with the term social determinants of health, but an important distinction can be made. Health-related social needs refer to the social and economic needs individuals experience that affect their ability to maintain their health and well-being. Health-related social needs are a result of a community's underlying social determinants of health. Health outcomes are the measurable results of an individual's health that can be attributed to an intervention on that person's life. Culture refers to all the ways of life passed down from generation to generation. Our culture might be reflected in our morals, customs, value systems, spiritual traditions, and even what we eat and how we dress. When addressing health equity, it is important to acknowledge different cultures' beliefs to better address everyone's needs. Bias is prejudice in favor of or against one thing, person, or group compared with another. When working to advance health equity, knowing and addressing our biases will help us identify and promote fair and unprejudiced behavior and practices. These are just some of the common terms associated with health and healthcare equity. The next segment in this learning series covers some of the factors that determine our health. Thank you for joining us.